Good afternoon, everyone. Oh, here she is. Hi, Irene.
Hi.
Okay. Good morning from New York. Good afternoon from Africa and Dubai. Thank you for everyone joining to the virtual Blockchain in Health Conference. Thank you for the organizers for inviting us to this exciting panel about how Africa responded and is responding to COVID-19 and how blockchain technology is impacting health and public health. Together with us this morning is our three dear friends, Dr. Ntuthuko Bhengu, IRENE, KIWIA, and John Kamara, who will share with us their experiences. And I'm sure we're going to learn a lot from what they have done. I must admit that this whole impetus started when I wrote a post a few months back saying that the African response to COVID was way better than that in the US, the UK, and in the European Union. And I got very furious responses saying that it's not true. It's simply that Africa didn't test and they don't report the right numbers. And I said, no, that's probably what we did. So to show the contrary and that really the public health response in Africa and the use of blockchain technology is robust, I would love our panel to tell us about it. So maybe as we start, we'll start with Irene. If you can just shortly introduce yourself and tell the audience a little bit about your experience of COVID personally, because I know that you're in Tanzania and you travel a lot, and you're also in Kenya. So maybe tell a little bit about how you experienced COVID and also the differences between the two countries. If you can unmute yourself, Irene.
Alex, can you please repeat the question? I lost you for a second.
So the question was, if you can tell the audience, I know that you work both in Tanzania and in Kenya, and they had two totally different responses to COVID. If you can tell a little bit from your perspective, what was the difference?
Okay, so as the world may know, Tanzania just very recently started taking precautions and acknowledge COVID. Our previous administration with the late President Magufuli had a different approach on how we managed and how we handled COVID. So being in Tanzania during that time meant, it was 2018, everything was just as normal. We did get some cases, we did lose a few lives, but the approach that we were taking was to operate as usual. So it was business as usual. And then next door in Kenya, where I also work, I would land in Kenya and it's COVID, very serious COVID protocols, from the airport to day-to-day operations. So it was quite an adjustment for me, and it was also very interesting to see two neighboring countries approaching the COVID pandemic from two complete different angles. And now we have a new president, Honorable Samia Suluhu, who has taken a very strong stand on COVID. So in Tanzania, we are practicing COVID protocols. We are taking measures. It's not still as serious as it's in Kenya, I guess, because of the cultural and behavior thing, where in the last year, where the world was isolating and taking COVID very serious, we were still operating as usual. But I'm excited to see even the extremity of things, because now when you land in Tanzania, it doesn't matter whether you have a COVID test from wherever you're coming from, you still have to take another COVID test. So we went from one extreme to another, but at least we're on the right track.
Thank you, Irene. And I think that's an excellent opening to the idea that public health is for the public, and it has to be in a societal context. We see this now in the United States with vaccinations, those who are vaccinated, those who are not. So these type of technological developments are not done in a void. Perhaps, John, can you share with the audience, you're the CEO of Afya Record, and you've developed a electronic health record built on blockchain. Can you share with the audience a little bit the features, the COVID features, and how you built that electronic health record?
Yeah, thanks very much, Alex. Happy to be here, everyone. Good morning, good evening, good afternoon. So as Alex said, I mean, for Mafia Record, our journey actually started before COVID, when we investigated the Ebola situation, and we were looking at the movement of disease and how do you manage outbreaks. Obviously, that was 2019. Then we were trying to build a platform that would manage multiple type of outbreaks or multiple type of diseases while protecting patient privacy and obviously giving the right of ownership back to the patient at the same time, and then being able to, timestamp and securitize this on the blockchain via a decentralized network. So fast forward, as we were working on this, COVID happened. So, which meant that the protocols that we had been developing for tracking diseases, tracing, managing the relationship between historical and real-time data, allowed us to then transform that to, a platform that we also then use for managing COVID. And really what we did from a technology standpoint was we looked at the human-centric approach to what we had to do, which is privacy of the human, but at the same time, public need, and there is a massive balance between what is my privacy and what does the other person deserve who is next to me, and that person is considered the public. So that was a big issue. I mean, being Irish, that I found in Ireland as well, and even when the likes of the big corporations were trying to develop these COVID platforms that nobody used, or even in China. So we took the approach to track the symptoms. So we developed a platform where we digitized all the COVID processes for the government project we did here in Kenya. And by digitizing that, because our platform has been built based on, it is probably the only health platform that is built around geolocation sequencing and also sequencing symptoms as well. So we don't track the human because that is a secondary track, and that also can infringe on the privacy of a person. But you track the symptoms and the movement of that symptom between the human and the multiple locations that you're tracking. So as the health officers collect the symptoms, as the nurses, onboard a patient to be tested for COVID, first of all, we have a visualization map where all of a sudden you can see everybody who has been tested in the whole country. So if you take a second to think about that, that means you understand everybody who is tested in your country. Just by knowing that alone, you're already winning. Before you even, and you understand the heat maps, but also in each of those individuals, because of the pockets, you also understand the symptom that each individual actually has. And the correlation of those symptoms across your whole country, I mean, it's a beautiful thing, if I say so myself, just to understand that. Then moving forward, after doing that, what we then did was sequence those symptoms with the location one, which is where the person lives, where they've come from to that test center. Then location two, which is a test center. Then we have what we call multiple locations, how the symptom moves. So as we understand, so when the platform goes on to the lab technician, all of a sudden, the map changes. You now see another dimension of colors. You see everybody who is tested positive and everybody who's negative and everybody who's also asymptomatic. Now, again, take a second to visualize that. Again, if any country could really understand this, it is a beautiful thing to see and to be able to actually assimilate it, to make urban planning of how you do anything instead of this idea that we would just do things, which most countries unfortunately have done. And then at that point, you're now able to ring fence the really high risk locations in your country. And as you ring fence those high risk locations, because you have accurate data, you have data that is impeccable, and you have data that is also on the blockchain, but you have not necessarily infringed on the person's privacy. So now you're encouraging your citizens, you got to now use this application to protect yourself. against, the movement of the symptoms. So as you then ring fence and you create what we call quarantine zones within your own country or state or region, everybody who hits that quarantine zone then gets an alert into their phone that this location, not this individual, very important, two separate things. Not this individual, not Alex, not Irene, not Dr. Bhengu. This location is a high-risk location. And with that, you can actually intelligently help people to understand the messaging. So on the same platform, you can tell the person this location is high risk, you need to be careful, you need to do X, Y, Z, so you're sensitizing the population by still taking all that data. At the end of that process, when the person walks out of that ring, which you've created, you can then take them and cluster them into a possible risk, which means you can send them another message and say, hey, look, you need to go get tested because we know you hit a high risk location. So again, this begins to allow people to feel that, you are looking at their privacy, which is an extremely important thing during this COVID, because a lot of the conversations around, COVID platforms were around privacy and what it does and who does what. But for me, I look at visualization. Understanding visualization helps you to plan and understand what it is that you must do better. So I do employ a lot of countries to really kind of rethink how they look at disease outbreaks and the kind of technology. And it's not about the technology, a little bit, Alex. It's about the human-centric approach to how you design technology. Thank you very much.
No, this is amazing, John. And this idea of geofencing instead of geolocation, the idea of where we don't have to sacrifice our privacy in order to protect public health is a very strong message. I hope that in the audience we have a couple of ministers of health that can hear what you're saying and say, I want your solution. I've seen it. It's amazing. It's robust. I want to move to Dr. Bhengu. If you could tell us, please, the situation in South Africa. And, John was talking about tracking people. We're now in the phase of vaccination and supply chain, about tracking things. So tell us, please, your thoughts about the difference between tracking people and tracking things, and where does supply chain and blockchain come in?
Thank you very much, Alex. I just want to say I couldn't hear John at all, but at least as long as I can hear you, that's fine. Thank you very much. Just good day to everybody who's on the webinar. Yeah, in terms of us here in South Africa, when COVID started to hit the ground running, we went into early lockdown and generally got good feedback from how our political leaders responded. And a year down the line, a lot has been done. We are actually now dealing with the vaccination effort. Obviously, it's a huge logistical exercise. We have also, as a country, have been unfortunate in the sense that we couldn't use AstraZeneca vaccines that had landed already in the country, and have had to actually have a stop-start situation with the Johnson & Johnson vaccine, but we're back on track in that regard. Now, your question about the supply chain is absolutely critical, because we experienced a lot of challenges that I say have to do with a supply chain that wasn't very well managed. And for example, you talk about procurement of medical supplies and verification and condition of suppliers, of products, and the suppliers who provided those. The issue of transporting them urgently to where they were needed was a problem. And of course, there was the unfortunate issue of theft and corruption. And one of the problems that one can actually point to is that the nature of COVID, of course, meant that we had no time to prepare. The entire world was scrambling for exactly the same resources at the same time. And what this did is it left governments, of course, at the mercy of intermediaries. And this created opportunities for price gouging, supply of inferior product, and suppliers who really had never been vetted before. And what one can look at this and say it's unfortunate that blockchain solutions have not been implemented, certainly not to an extent that would be impactful. This would have made a significant difference in dealing with those supply chain problems, because even if you look at the blockchain solutions in pandemics framework that I read some time back, the three key areas, of course, would be the supply chain, the health data management, and of course the skills and talent registry. So along these three specific areas, we could have had a much more responsive approach to this. As a result, we took some time battling to just identify health practitioners. We found out that there wasn't a single database of health professionals that is dependable in terms of information that's up to date and readily available. So the issue of identity there could have been handled differently. And of course, if one looks at the data, the health data for the vaccinees, it also has been work in progress, where we are putting a system together, but also the three key areas where I believe a blockchain-backed data management system would have helped in relation to vaccinees is, first of all, is really just the registration with informed consent. Instead of asking especially older people with limited access to the internet, it probably would have been much quicker to onboard onto a national system based on sovereign identity on blockchain platform. One of the other issues other than registration is the investment. If there is one party that's paying, for example, if it's government. In South Africa, everyone is guaranteed vaccination, so government takes care. You do not need to afford, which is a good thing. But health insurers have also taken responsibility to pay for their members, and certainly employers also have taken responsibility to pay for those employees who do not have insurance. What this means is that at the time that a vaccinee presents themselves, they need to identify who's paying. Is it government? Is it a health insurer? Or is it employer? Now, you can imagine if we had some sort of self-sovereign identity which comes preloaded with this information, it would be much easier. We're spending quite a lot of time trying to avoid duplication where someone is paid for by one party while also qualifying for another. And of course, the third point here is really about the vaccination history for future purposes. Alex, I'll stop here for now and maybe...
Excellent. Excellent points, Dr. Bhengu. And again, both you and John and Irene have brought up these use cases all around the self-sovereign identity, all around the possibilities of a self-sovereign electronic health record with AI semantics and cluster analytics, the whole idea of credentialing both from the buy side and the sell side, as well as fraud detection and the avoidance of bad behavior like price gouging or selling bad things. I want to, and as I promised, this would go really fast. We're already at halftime, so I'll just circle one more time with the three of you, and we'll call it the day. But for Irene, a lot of times I say when people ask me how is Africa doing so well compared to other continents, and of course on personal levels we've all had our losses. but on a societal level, it is doing so much better than what has happened in Western markets. What are your thoughts about it? Is it about age, being younger? Is it about the attitude to public health in general in Africa? And from that, can you almost share with us what do you think is the adoption of blockchain and these new types of amazing things like John described with Afya Record? So please, Irene.
Thank you, Alex. So I love talking about really how COVID has hit Africa, because one of the interesting things that we often say in our different circles when we're talking and evaluating this is on how the fact that Africa has experienced suffering for a long time, is one of the things that is helping us down. When we talk about the majority of Africans, over 80% live under poverty lines. This means that, they don't have the same privileges that the Western countries have in terms of everything from, living in safe and clean environments to eating the junk foods and all these luxury foods, so then our bodies have adopted we're used to how do I say, like, we've adopted to being sick, or we've been exposed to all these different types of things. So I guess our immunity is stronger in that aspect, but we also live really from farm to table type of lifestyles where, as much as most of the food we eat is not that much balanced, but it's also very healthy food because it's not processed, it's not, so that means we're healthier. And Africa is a young continent, the average age is 18, 19 years. So there's a lot of young people on the continent, and I believe these are some of the issues that have contributed to the effect, the minimal effects, so to speak, in comparison with how the rest of the world has been impacted. And when we now talk about blockchain, there is still a lot to be done because it's still a very foreign term. It's a foreign thing, from people who are in technology to, end users and consumers, so there still need to be a lot of education around what it is and what it means and how it can be applicable. And we don't have, even on the continent, a lot of talent, around blockchain. So there's a huge gap in capacity building. When we talk about blockchain, the first thing that comes to mind is crypto trading and cryptocurrency, which, a lot of the countries in Africa are looking at in a very, with speculation because of the trends that we have experienced, with crypto trading, where there's a lot of scams, etc. So when you talk blockchain, it's directly linked to that. And then there's a lot of negativity around that. So I would say huge potential for capacity building, from building capacity across the tech specialists, software engineers and people who are in the tech development industry, but also educating the policymakers and the different leaderships from public to private so that they understand what it is and what potential that the technology has in the businesses and its applicability to then reaching consumers, so that they see it as a positive thing and something that will also add value and that will solve problems.
Wonderful. No, these are very inspiring words. And of course, I agree with you. Your food is second to none, and I recommend everybody to
especially Tanzanian food.
we won't start that very hard debate, but definitely being young, healthy, and eating good food is a secret for a healthy and good life and public health. John, tying into that and to what Dr. Bhengu was talking about, in terms of the whole data management, can you please speak to your health information management system that you've developed, and how did you structure it, and how does that connect to the AI Center of Excellence and tagging into what IRENE was speaking about, developing capacities.
Thank you. Just to touch one thing on IRENE said, I think one of the things that's also important to sort of take notice of is the lack of data. Because a lot of these things that's happened with COVID, and I'm happy to have conversations with people outside of this, is there is very little understanding of historical data of so many different populations and so many different indigenous type people. Because if you understand the historical data and you're able to merge that historical data with what is happening now, then you understand the better trend analysis of why certain symptoms of certain diseases only end in certain type of people. And there's a really, really strong correlation around historical data, which we don't have, and the few that we've used, data doesn't lie. It's very glaring. And what is happening to people, so that's also something that Africa needs to really leverage a lot on, to try and, bring out a lot of this data from so many pandemics that have happened, which, Ebola was a dangerous pandemic. It's just, it only happened in Africa. That's why the world didn't really consider it such a big thing. It killed you very quickly as well. So just going back to what we're doing in healthcare, when we started looking at the healthcare ecosystem, we thought to build a toolbox, rather than a software. And because when you build modular solutions, it means you can unplug it and plug it where it is required, which necessarily doesn't mean that you're trying to hand something over to someone, but you're creating a number of tools that different people, especially the patient, can use to actually participate in their own healthcare. So the whole idea of Mafia Record premise was built around building different toolkits in the box that a hospital can use, that a doctor, an insurance company, all of it geared to the one most important individual and 7-point-something billion people on this planet, the patients, which all of us are. And I think, speaking to a lot of health practitioners, I would employ them to, for 1 second, realize and remind themselves that they're also patients as well. Everybody is a patient at some point. It's only when you become a patient that you really understand. So when we built Afya Record, the idea was we build a health platform where we can provide, based on structured data sets on a decentralized blockchain network, that then allows us to collect accurate type of data, not just collect data. So that when you're actually collecting this data from the hospital, the data is already pre-prepared to be machine learning ready. So the day you start adding decision protocols to it, the day you start adding tools to mine that data to start making better decisions, better serve, because there is no AI, there is no without clear, precise data. And that data, as you're collecting it from day one, this is what Afya Record does. Then also, we created a patient port. This is what we call the Gmail of healthcare, where you basically Gmail yourself into your healthcare from every health facility you ever go to. So for the first time, in my life, I'm using now, I have all my health record in one place, and I have a very simple AI tool that helps me analyze that. So I've already leapfrogged healthcare because I understand my own healthcare now. This is what Afya Record offers to every patient. The opportunity to have access to your healthcare data or to store and have your healthcare data all in one place and have very basic engine to also participate in your own healthcare as well. So from the hospital that we provide software for, solutions for, including, OHR systems, EHR, EMR systems, and whatever it is that they're looking for, but knowing that all of it is in a decentralized network to the patients, that we then give this access of their healthcare data or also give them tools, a platform where they can actually curate their healthcare data from every hospital to the applications we use to help them manage their healthcare outside of the hospital. So this is what we are doing, and what we're believing that as we embark on this journey to empower 1.3 billion people in this continent to own their own health data, we believe that Africa would definitely leapfrog the rest of the world in terms of patient and data-driven healthcare. And because we don't have the infrastructures that the rest of the world has, and we can't pay doctors all kinds of money, that's why they all leave to Europe. And we can't build hospitals in villages because most of Africa is still villages. So by the time you build a hospital, you need to equip it with electricity, you need water, all those things. That's why this infrastructure cost is so expensive. But we produce data consistently. And we can leapfrog with data.
No, this is excellent, and an excellent point on the data historicity. And this, of course, brings in the whole idea of genomics and inclusivity and how our international clinical trials have to include the richness of what the African continent has to offer, and to remind everybody that is the birth of humanity. And so really in that sense, that taps into a lot of other themes. And I do want to take that and bring it to Dr. Bhengu, and then we'll unfortunately have to start to wrap up this. I knew this was going to happen, and it will be going so fast. Dr. Bhengu, you work a lot with the South African government, with state agencies, with people who maybe are not exposed or know all these decentralized technologies. Could you share a few ideas that you have with the audience on when you explain blockchain technology and when you explain what it wants to achieve? What are the main themes that you talk about when it comes to what it can do on data management and public health?
Yes, thanks, Alex. I think the point is really about starting at the main overarching goal for Alchemy Health Technologies, and it's simply to reduce the cost of delivery of health services by developing a digital technology platform that will enable efficient management of health data and payments. And key to our target audience, as it were, or users, are clearly patients, service providers, insurers, and governments, essentially throughout the African continent. Now, what is critical here is to go back by starting to where the problem areas are. And we're very clear that it's about going back to getting directories that are reliable, dependable, because, again, COVID exposed us that we did not have a reliable one for practitioners, for example, patients as well. But even if you go past that, we do have an interoperability problem, which can be addressed through blockchain. The private sector certainly has got the more reliable data and information about costs. But again, you are dealing with siloed information that's not visible to the entire industry, certainly not at patient level at the time that care is needed. So that is certainly a problem. Then in another box, we have got practitioners who really aren't as digitized as we all know they should be as partners to the patient. And that is an issue that needs to be addressed. But again, a lot of these things ultimately speak to the triangle that has patient and population wellness right at the top, as HIMSS sort of so clearly depicts in its triangle. But to get there, it's about digitization. You, Alex, always talk about leapfrogging. And I think blockchain will take us there in terms of saying we are where a lot of data is still captured by hand and sitting in cabinets, but we can move quickly and not just to catch up, but be ahead if we adopt the right technologies. I mean, my mind is very clear that blockchain would certainly be one of those, not suggesting it's the only solution, but certainly a key part of dealing with the safety and security of data, the interoperability problem, and of course, fraud, waste, and abuse. It is said that healthcare is healthcare, and similarities in terms of systems are pervasive across the country. But one of the issues that they are a problem for us is medical malpractice litigation. One of the provinces here in South Africa announces every year that almost a third of its budget has to be reserved for medical legal litigation. In the private sector as well, we see that the South African Society of Obstetricians and Gynecologists tells us that every year South Africa loses between 70 and 100 obstetricians who stop practicing the obstetrics part purely because of medical legal litigation. And a big part of that is that records aren't secure. They can still be manipulated, and blockchain, of course, will help us deal with those problems because of immutability and, of course, the security. And the costs of having a general practitioner examine you, order lab tests and x-rays, refers you to a specialist who does the same thing 2 weeks ago, simply because they don't see your records from 2 weeks back, is a big picture. It is a big picture issue, and it's certainly one of the areas that Alchemy wants to have impact.
Excellent, excellent. So we need to wrap up. I knew this would go fast, and you guys are awesome. So I'll do a quick 30 seconds each one. I'll start with Dr. Bhengu, then John, and then we'll finish with Irene because everybody has to hear her voice and then move to the next panel. So we'll start like this. How long will it take for people to see the wisdom that you have? You've developed wonderful things. They're all ready to go. Are we looking at waiting a year, 5, 10, never? Dr. Bhengu, please start. How long?
Well, we've set ourselves a target of end of this year to enter to put our offerings in a more visible way to the market in South Africa.
Excellent. Thank you. John, when will the world see the light of crypto and blockchain?
People will adopt it, but they probably will not understand what it is that they're doing, but that's okay as well.
Very good. Very good. Irene, inspire us. What is the future?
Now, the future is very exciting, especially because whatever we're doing now, we are ensuring that, data accessibility or data collection is simplified, and it's structured. So, and we all know that that's a starting point, yeah? How to make data collection accessible and convenient. So the rest of the building blocks will take a little bit of time, but it's already happening. And the other thing, I know you said 30 seconds. The other thing is, Africa is an exciting place because we're solving problems. So whatever that we're innovating is linked to the SDGs, which, as we all understand, these are like very important goals to ensure that the continent addresses some of the key issues that are hindering its progress. And if COVID has taught us anything, this progress in Africa is also linked into the global progress. So the world has to step in, participate, and be a part of what is taking place in Africa.
Thank you. No, I totally agree. And being your friend has really been a transformational experience. I want to plug in that next week is going to be Africa Blockchain Conference starting on Monday for the whole week. Come and listen. We have John Kamara who will speak there, and we will also make the very important announcement that we're opening the Africa Blockchain Center to continue and develop these capacities. So thank you guys for doing all the wonderful things that you're doing, and we will continue and leapfrog and change the world because everything comes from Africa. Thank you.
Thank you.